Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. First up, one of the most common medical conditions around, arthritis. Caused by inflammation of the joints, it impacts the daily lives of millions. This week, the CDC published a vital signs report highlighting the growing incidence of arthritis. Using health data from 2013 to 2015, the CDC estimated that about 54 million adults in the country have arthritis. That equates to about 1 in every 4 adults. The CDC also found that nearly 60% of arthritis sufferers are of working age. So, Tara, did the study look at how that impacts people's working lives, their daily lives?
It did, and it really creates a picture of arthritis as being disabling and affecting quality of life. And so for about 24 million Americans, it affects everyday activities, things we take for granted, like picking up our coffee cup, bending over, walking a couple city blocks, picking up your grocery bags. So it's a big issue for lots of Americans. And in addition, it impacts people who have other diseases like heart disease, obesity, and diabetes. It makes it more difficult to manage those diseases. People who have arthritis are twice as likely to suffer an injury related to a fall. And not surprisingly, it impacts mental health. So about 30% of those over 45 also have anxiety and depression.
Wow.
Jon, is there any sign this is decreasing at all? What's the future look like?
No, it's going up, right? So it's going to go from 54 million to 75 million estimated in 20 years because we're going to get older. And I have to echo what Tara said. You know, this is something we take for granted, right? My entire life, you know, I thought it was a miracle that I could say, go up to my wrist, go down. It doesn't hurt. You know, you have to appreciate that.
Yeah, love your
and
wrist.
then it's not until you start to have pain that you realize this is a big deal.
Yeah.
It's serious.
So, Tara, if adults have arthritis, what can be done?
Well, the biggest thing is physical activity and to remain physically active, whether it's walking, swimming, cycling. That's been shown to reduce pain and to reduce symptoms by about 40%. In addition, they need to maintain a healthy diet, a healthy weight, discuss any medications with their doctors. And then there are disease management education programs, and those can really help patients learn how to build their confidence and skills about managing their disease. And it's been shown to also decrease pain, fatigue, and depression.
All right, next up, advances in science and technology are helping us find new ways to fight back against cancer, including immunotherapy. The technique harnesses the body's own immune system to find and destroy cancer cells. In this clip from tomorrow's CBS Sunday Morning, Dr. LaPook takes a look at this evolving science.
12-year-old Ezzy Pineda will tell you what happened to her seems like a miracle. Back when she was just 9, feeling weak and dizzy, she was taken to a hospital on Long Island, where doctors gave her a diagnosis she barely understood: leukemia. 98% of children with this form of cancer respond well to chemotherapy, so her doctors started there. But after 4 brutal rounds, Ezzy's cancer was getting worse.
And a natural reaction is to think, why me?
Yeah, I was like, what did I do bad so that God could give me this punishment?
Desperate and out of options, Ezzy had one last chance. She was enrolled in a clinical trial for an experimental treatment.
How's everything?
Good.
How are you feeling today?
Good.
Everything
After
well?
6 weeks, Dr. Kevin Curran, the pediatric oncologist who treats Ezzy, couldn't find a single leukemia cell. Not one.
You know, it is a very exciting technique. I mean, think about a bloodhound, giving the scent to a bloodhound. It's like giving the scent of cancer to your own immune system and then having it go after the cancer cells. But, you know, at the same time, it's a careful, delicate line you have to walk when you're talking about cancer, because at the same time, there are all these exciting new possibilities. There are people out there watching this right now who have metastatic cancer, and they or their loved ones are really in big trouble. And tomorrow on Sunday morning, CBS Sunday Morning, we're going to talk about the whole waterfront, about over-treatment, over-diagnosis, about new ways of treating it with immunotherapy and other modalities. And there's also going to be a tearjerker or two. There's one very beautiful piece that Ben Tracy does about a little boy.
The whole ecosystem.
You can catch the full story and more tomorrow, as Jon said, on a special edition of CBS Sunday Morning, Beyond Cancer, hosted by Jon.
Finally, an innovation in stroke treatment. In 2014, the Cleveland Clinic started using mobile stroke units, ambulances specifically designed to improve treatment times for people who suffer strokes. They also have telemedicine capabilities, meaning a neurologist is able to remotely evaluate a patient as he or she makes his or her way to the hospital. A new study this week examined the benefits of these telemedicine ambulances. Dr. Narula has a look at the results.
All of a sudden, I had a very bad headache.
When Monica Stanberry suddenly began to feel sick last Friday, her daughter called 911.
They were asking me to lift my legs and my arms and stuff. At first, my leg wasn't lifting anymore.
A special mobile stroke unit responded. It's equipped with a CT scanner,
Is there anybody with her that was at the time of the stroke?
a video conferencing system to communicate with doctors at the hospital, and drugs that can stop the most common type of stroke in its tracks. Remotely, a neurologist diagnosed a stroke and ordered life-saving medication. Dr. Muhammad Hussein managed her care at the Cleveland Clinic.
So this actually allows us then to go right to a person's home, be able to make a definitive diagnosis of what type of stroke it is, and then that allows us to deliver the right type of treatment immediately.
The most common type of stroke occurs when a clot cuts off blood flow to the brain. Quick treatment with a drug called TPA can dissolve the blockage before brain cells die, preventing permanent damage or even death. Dr. Hussein's new study found that patients treated by a mobile stroke unit get TPA an average of 38 minutes faster than those transported in a regular ambulance.
It can make all the difference in the world between a person being able to walk or not being able to walk, for a person to be able to go home versus having to live in a nursing home.
So Tara, is this the forefront, specialized ambulances?
Anything that can streamline the process, I think, is going to be important because strokes are so frightening. They're so debilitating. They strip you of the essence of who you are.
And time is so critical.
Time is critical. And when you get to the ER in a regular ambulance, you have to wait to see the ER doctor, the stroke doctor, get the scan read. So this is really an amazing innovation.
Drs. Jon LaPook and Tara Narula, thanks as always.